Welcome, everyone, to our January 28th Community Cafe. It's great to see so many faces here today, and welcome. I am going to turn this over to Tara Conrad.
Thank you, Jerry. Good morning, everyone, and welcome to our January Community Cafe. My name's Tara Conrad, and I'm the Senior Director of Engagement here at Partners Health Management. We've received several requests for an updated overview of our department and the work that our team does. While many departments here at Partners engage with our members, families, and providers, community engagement specifically focuses on working with our community stakeholders, including our nonprofits, community-based organizations, schools, county agencies, county leadership, and elected officials. Our department is made up of several teams with distinct roles, all centered on strengthening our communities and improving the lives of our members. Today, you'll hear about our community training efforts in physical and behavioral health, our outreach and engagement initiatives, work addressing the cultural needs of our Native American members, our non-emergency medical transportation efforts, and our commitment to keeping the member and family voice at the center of everything we do. With that, I'm going to turn it over to Amber Matthews to share more about our training offerings.
Thanks, Tara. I'm Amber Matthews. I am the Community Engagement Training Manager, and I just wanted to give a little plug for all of the trainings that we offer. We do offer trainings open to the community. They are in person or online, whichever is most convenient for you. We do offer our trainings for free. Each month, we offer anywhere between 15 to 17 or 18 virtual trainings. If you would like to be added to that listserv, please email cetraining@partnersbhm.org, and you can receive that flyer each month that goes out with our monthly virtual trainings. We also do trainings on demand. So if you or someone you know could benefit from some trainings that we offer, you could email us and we can get you on our calendar as well. Again, no cost. I will say that there is a cost when it comes to mental health first aid. That is an 8-hour day-long session, and it really talks about how to talk to someone who may be experiencing a mental health challenge. And there is a certificate that comes along with that from the National Council. And I will say that we have to buy those manuals. So the only charge we have is the manuals for that specific training that we offer. We have a variety of different trainings that we offer. I want to highlight just a couple because this is the full list. We do things like active listening and de-escalation. We also recently offered or are offering a new training on emotional intelligence, and those two kind of pair really well together when it comes to learning about emotional intelligence and how we can manage our emotions in the moment, and then what we can do to cope with those feelings and emotions that we're experiencing, which leads really well into how do we actively listen to someone else and de-escalate a situation that may be a crisis situation. Another training that I would like to mention is our community resiliency model. You may often hear about this and refer to as CRIM. Our CRIM training is evidence-based, and it's also really focusing on shifting our thoughts and feelings to what's physically happening and those physical sensations that we're experiencing within our bodies, and then what we can do in order to cope with those things. So if we feel dysregulated, what are some tools that we can use in order to regulate ourselves and bump us back into that place of resilience? Another one I would like to mention is QPR, which is question, persuade, and refer. That is our suicide prevention training. It is 3 easy steps: how to ask the question, how to persuade someone to get help, and who to refer them to if that person's experiencing suicidal thoughts. You don't have to be a therapist. You don't have to be, you don't have to be even in this field at all to take this course. But it's really just noticing the signs of what potential suicidal thoughts can look like, and then also how to intervene and who to connect them to. It's kind of like the CPR of mental health, right? So learning those skills and applying them in our everyday life. I will also mention quickly, we have simulations that have started as well. We have an unhoused simulation that we're actually going to be trying to do virtually in February at the Community Cafe. We also have a mental health simulation that's offered upon request. And then we also have a poverty simulation. We do have a poverty simulation scheduled in Surrey County. If you are close to there or want to participate in that, please let us know and we can get you that information as well. We offer a lot of other trainings, but I do quickly want to pass it to Amani because she's going to talk briefly about our physical health trainings that she offers.
Thank you, Amber. Good morning, everyone. I am Amani Pegues, and I'm the health educator with the training team. And my role involves providing comprehensive physical health trainings, such as you can see on your screen, Diabetes 101 and hypertension. And then I also provide the physical health components to our other trainings, such as Mental Health 101. And we provide physical health trainings because we want to make sure that we're providing that physical health education and integrating that information into our mental health trainings, just to make sure we're focusing in on whole person care. So I will now pass it to Christy with the Heart Team.
Thank you, Amani. I'm Christy Wilcox. I'm a QP on the Health Education and Aging Aid Resource Team. Are the team formerly known as GAST, which is the Geriatric Adult Mental Health Specialty Team. So if you haven't heard of HEART before, but you've heard of GAST, we had a rebranding back in July of this year. So what HEART is a state-funded initiative to provide training to long-term care facilities, community agencies, and other stakeholders for older adults with mental health and substance use needs, as well as dementia. We offer trainings that are free of charge, both in person and virtually, with continuing education credits provided. So you may be wondering, why do we need geriatrics specific trainings? And the answer, just with numbers, is by 2032, 31% of our population will be age 60 and over, a lot of that attributed to the baby boomer generation. And a lot of those individuals choosing to live in the community while managing dementia, mental health, and substance use challenges. So, with aging adults, a lot of times there is also more complex physical health needs, and a lot of times they are more so seen by their PCP, EMS, the ED departments, and their mental health, substance use, or dementia may go undiagnosed, or those providers may not have the time to offer training, education, symptom management, and wellness that the HEART team can do, and that's the gap that we aim to bridge. We offer trainings, like I said, both in person and virtually. I'll put my email in the chat if anybody's interested in learning more about those trainings or upcoming webinars. And with that, I'll pass it to Dwayne.
Well, good morning, everybody. I'm Dwayne Gaskins, and I am the System of Care Community Engagement Manager. Glad to be here. So the community engagement specialists participate in a wide range of meetings, partnerships, and initiatives. As part of the tailored plan, we really look to support children and adults who are struggling or needing help to support them with physical health, mental health, substance use, intellectually or developmental disabilities or traumatic brain injury. They are really the community engagement specialists are really about engagement and collaboration. We engage in a great variety of people or groups in the community, including but not limited to, as the list let's see, yes, as the list presents here, both physical and behavioral health providers, pharmacies, community-based organizations, nonprofits, faith-based groups, agencies, members, advocacy groups, and others. including leading groups for those who help juvenile justice involved youth. We interact on a micro level, which means that we collaborate with organizations and not so much individuals seeking help. If we are engaged by individuals in the community who need help, we connect them mostly with our partner departments of member engagement or care coordination. So, how we collaborate is mostly done in the following ways. We have monthly county collaborative meetings in which any community member can attend. During these meetings, we share information and resources. We have educational presentations. We have discussions and identify gaps in services. We develop and discuss goals to address these gaps. We identify and reduce barriers to delivering services and meeting goals. We discuss the utilization of funds to meet these goals. We also work on special projects. And finally, we progressively update and hold each other accountable as to the progress that is being made or the funds utilized. We also have special monthly meetings in juvenile justice um, uh, with those folks that include court staff and the providers who are working with our youth there. In addition to the county collaboration and juvenile justice meetings, we also have collaboratives in some of our counties that meet in the same manner to focus on children or adults who have intellectual or developmental disabilities. Finally, another way we engage and share information or collaborate is through special events. These are events that occur at any time during the week, weekday, evenings, weekends, and these events are conducted all over the place, and each has a special focus. They allow us to reach out and connect and provide information about available services, how to access them, and offer vital information. Information about these events or also how to connect and attend these county collaboratives can be found on our website. And you can see that link there below. So thank you. And now I will pass you on to Shelby Holland.
Hi, good morning, everyone. My name is Shelby Holland, and I'm an enrolled member of the Lumbee Tribe, and I proudly serve as the Tribal Liaison for Partners Health Management. A little background, the Department of Health and Human Services has required all standard plans and all tailored plans to have a tribal liaison in hopes to better support the tribal community. Ways that I can do that are by helping our staff and our community members understand the needs of our tribal members, as well as providing training on the Native American population for our stakeholders and our providers that we are contracted with. The reason that we prioritize this is because of the health disparities and social determinants of health that the tribal population faces. We want to make sure that our providers and stakeholders know how to treat tribal members effectively. One of the most important hats that I wear is that last box. I work really closely with tribal leaders of all the tribes in North Carolina and the leaders in the Indian urban organizations as well across the state. The hopes are to build a network to support our members that identify as Native American. And partners knew that this was going to be tricky because of the historical trauma that Natives faced with government agencies. So partners really prioritized hiring someone who was an enrolled member of a North Carolina tribe to help build those connections a little bit easier. So that's a little bit about my position. I'm going to hand it over to Alicia now.
Thank you, Shelby. Alicia Cunningham, System of Care Family Representative with Partners Health Management. As the family representative, I represent the family voice in collaborative and community meetings across the partner service area. In crisis intervention teams training, I highlight real life challenges families encounters, and strengths they bring as they navigate the behavioral health system. My position is a macro role, meaning I focus on system level things rather than individual cases. So with that being said, I do not access any protected health information. I do not represent any specific family. I don't work with individual cases. Above all, my role is to ensure the family perspective is heard and system level planning and partnerships. So thank you, and I'm going to pass it over to Casey.
Good morning. I'm Casey Vinsky with Partners Health Management. I am the transportation manager. And with doing the NEMT, non-emergency medical transportation, it covers only for Medicaid funded medical services. It does not include non-medical or convenient trips. There are specific authorization requirements. Trips over 75 miles require review and approval for Carolina Complete Health, which is the CCH. And then the out-of-state requires a prior authorization from partners. So if the member is going out of state for services, that will require partners' approval before this can happen on the transportation. Members under age 18 must have an adult attendant when using transportation. These guardians help ensure services are used appropriately while still protecting member access to care. Our goal is to support members in accessing care while maintaining compliance and program integrity. And transportation follows North Carolina Medicaid policy and partners' tailored plan requirements, ensuring trips are appropriate, authorized, and medically necessary. We can go on to the next one. Okay, so see, these are just some of the numbers that from last year's review. During fiscal year 2024 to 2025, we received over 354,000 one-way trip requests. With an overall approval rate of nearly 97%, which is great. More than 1,900 unique tailored plan members use NEMT by June 2025, showing steady growth month over month. Importantly, denials were primarily driven by member ineligibility, not a lack of transportation capacity, which is a great thing. Just not being denied is a great thing if we can get those trips for a medical necessity. Overall, the data reflects strong access, high approval rates, and growing utilization across the tailored plan. Together, this shows how NEMT continues to be a vital access point of care while remaining closely aligned with policy and oversight. And just really looking at those, the approved trips of 343,631 and the denied trips and how different that is a great thing. So moving on to Melissa.
Thank you very much, Casey. Greetings, everyone. My name is Melissa Ross, and I serve as the Regional Director of Community Operations for Cabarrus, Stanley, and Union counties, as well as oversight of our HEART team, which you heard from Christy. I am one of 5 regional directors, and the regional director provides regional leadership with partners that is external facing, providing oversight for behavioral health, developmental disabilities, physical health services across our catchment area. We identify barriers to accessing care, which includes gaps in treatment and service needs. We facilitate as well as support disaster and emergency shelter planning. We also further facilitate our crisis collaboratives in all counties, developing and sharing resources to help alleviate overutilizing of emergency rooms where clinical care is appropriate. Under community engagement and oversight, we serve as a primary liaison to our counties, our stakeholders, providers, and other community agencies and organizations. We represent Partners Health Management on community boards, in community forums, events, and other macro level meetings. We address behavioral health and physical health concerns with solution-focused approach to support safe and effective care for our members and communities. And finally, we collaborate and oversight with our county leadership in the development of the strategic plan to utilize our maintenance of effort funds, our single streamed funds, which is non-UCR funds, and our ABC funds. The other regional directors are Jeff Eads, who covers Surrey, Yadkin, and Iredell, Jamie Piercy, who covers Cleveland, Gaston, and Lincoln, Jackie Copeland, who covers Davie, Forsyth, and Davidson, and Paul Holden, who covers Burke, Rutherford, and Catawba. And now I will pass it over to Jerry Kennedy. Thank you.
Thank you, Melissa. Before we get into what the Community Cafe is for the future, I did want to spotlight a particular training we offer. And with that, I'm going to turn it back to Amber Matthews.
Thank you. I'm so sorry. Alicia mentioned CIT, which is Crisis Intervention Team Training, and I realized that I did not talk about it at all. So thanks, Jerry. A big component of what our community trainers do is offer Crisis Intervention Team CIT training for our law enforcement and first responders. We have active CIT programs and trainings in all 14 of our counties. And we also support Forsyth County as they also work with CIT as well with the Mental Health Association of Forsyth. This is a 40-hour training that law enforcement and other first responders can attend. And we spend all week talking about different areas of behavioral health and, how best for a first responder or law enforcement officer to respond to someone who might be in a mental health crisis. So some areas that we talk about to them, we have subject matter experts come in and talk about aging adults. We have a subject matter expert to come in and talk about deaf and hard of hearing. We talk about suicide. We talk about medications and what are some side effects that medications can cause. We talk about veterans specifically. So we talk about different populations of people and how best to relate to them and how to connect with them to build that rapport. And then also give them some alternative options as it looks like for support and what that looks like within the community if that person does not need to necessarily go and be booked in jail. So that is a big thing of what our community trainers do. And I will say that we've had lots of community members ask about that specific training opportunity. And I will say currently it is just for law enforcement and first responders because it is a jail diversion program. But hopefully we may look in the future about how we can give snippets of that to the community as well. So thank you, Jerry. I appreciate you allowing me to do my little commercial.
No problem at all. I think that's a critical component to what Partners offers our 15 counties as well. We'll pause right now to see if there's any questions for our panel that has spoken, anything from the audience, and we'll look in the chat box, or feel free to unmute yourself. And if you unmute, please, if you can, put your video on, that way we can see you, but feel free to ask questions to the group about the different departments.
I would like to add one thing when Amber was talking about the CIT class. One really important part also of CIT is the voice of people who have lived experience. So if anybody ever would like to volunteer to be part of, to speak in the local area, local CIT class, we would love to have more people who could tell their stories.
I'll ask a question to Shelby while we're waiting. I actually requested Shelby to come speak about what she does in our communities at a local event. And I asked the director of the program, and their initial response was, well, we don't really serve that many people that are Native American. She came and she did speak, and there were approximately 30 people in the room. And if I'm not mistaken, at the end of it, 4 individuals walked over after the meeting and spoke with Shelby. So Shelby, how would people that are interested in having you speak with community groups, how would they leverage you, and what different things? And I know you spoke some about it, but would you give a little bit more information?
Yeah, Jerry, thank you. Also, just to piggyback, also out of those 4 people, 2 of them identified as Native Americans. So the leadership in that group didn't even know that they had Native Americans within the group, which is not their fault. But a lot of people do identify as Native American or have that heritage that they don't know about. They want to know a little bit more about. So you never know who's sitting in the room. But to answer your question, Jerry, I can obviously put my contact information in the chat. I do a lot of, we also have a tribal webpage that has a lot of good information, a lot of good resources. It also has some of the trainings that I've done for partners that is either in Community Cafe. I think I do maybe 1 or 2 a year here at Community Cafe, and we have a member cafe as well that I present at. And if obviously any provider stakeholder is interested, we do outsourcing as well. And I can put that webpage down below, and I can also, or in the chat, and I can put my contact information as well. Jerry, did I answer your question? I'm sorry. You're on mute.
Absolutely. Thank you so much.
You're welcome.
Are there any other questions for our panel? All right. Well, so to let you know, the community cafes are happening virtually every month except December. We do take off, mainly to do some planning. We cover a variety of topics in the community, as you can see today, what we've done. And if you go to our partners YouTube page, you can see all the ones we've already done. There are some great ones there that you can take a look at and pull up. Feel free to share them. If you see one you like and you'd like for us to come and present to your group on a particular item or topic, please email myself or anybody on the team and let us know. We're more than happy to make it portable in our 15 counties and help serve the community better. All of our community cafes are free and open to everyone. So not just you that works in the field, invite your local leadership in the community, elected officials, anyone you feel like that might benefit from hearing about what we're doing, including this cafe. A lot of you may not have realized the different things that our community engagement team does. And this is a great opportunity to share this information with others in the community. So feel free to invite others on it. Last thing, you can see the email is there on it, and I apologize. My vision isn't good enough to pull that off and see that well. But next month, February 25th at 10 a.m., we're going to be doing a simulation. And this simulation will walk you through the life of a person that has lived in an unsheltered situation. So it should be really powerful and meaningful. And again, it's so important that we invite people in the community to learn more about what's going on in our community with those that have needs. Thank you so much, and everyone have a wonderful day.
Thank you.
Just real quick, can we get a copy of this presentation? This was a lot of information that came really fast.
Yes, Greg, this should be posted in give or take a week and a half. So usually around 10 days, we'll have it up on our partners YouTube page. So if you go to Partners Health Management and YouTube, I don't have the link right in front of me, but if you'll pull that up, it'll be posted there. And again, there are a number of additional videos that we've done for our community engagement department, as well as our other departments and partners that give a great variety of information. And from there, if you see something you want to take back to your group and have more information, please let us know. We're more than happy to help.
Greg, I can also type up a synopsis of everything we talked about today and put people's emails in there and send it to everybody if that would be helpful as well.
That'd be very helpful.
Information. We had a lot of people talking and we were afraid we were going to run out of time. And look, we gave y'all 30 minutes back, right? So I can type up a quick synopsis and send it to everybody that was in today's cafe. I'll do that this afternoon.
Thank you. That would be very helpful. Thank you.
And Jerry, real quick, for the homeless simulation that you're doing, where do we sign up for that?
Yes, so the new link for February moving forward, we're getting ready to put up. So the old link is not active, as you were one of the ones for sure that let me know today. Thank you.
Okay.
And a couple others. So that link will be coming up within a week or so. And I will definitely be sending out to the collaborative. We'll be sending out via the collaborative email listing. So if any of you are not on the collaborative email, if you'll email our department number, we can get you linked to that to make sure you're getting our regular communications as well. And I know, Tanya, you get them, but for others that don't get them, if you want to, just there's no wrong door, and we'll figure out who needs to be the right person to connect you to.
Thank you.
Thank you, Tanya.